It's been well understood that chronic inflammation is the cause of a lot of chronic symptoms that people suffer from, and the really bad diseases that we're all pretty wary of. It's been increasingly clear that chronic inflammation is physically located in the gut microbiome. The immune system, well, if you think of the word inflammation, it means the immune system activated, the turned on immune system. And the immune system is located in the gut. Why is the immune system located in the gut? The immune system's job is to protect us from infections. Infections occur from bacteria and microorganisms. And the microorganisms are located in the gut. Therefore, our Creator designed us to have the immune system located in the gut. So, if there's damage to the microbiome, the immune system turns on. That leads to chronic inflammation, which is something very measurable. That's something that can be picked up on blood tests and salivary hormone tests. And the microbiome, features of the microbiome can be discovered using specialized stool testing that reveals, using DNA testing, we can learn what are the microorganisms in each person. The diagnostic process, as I mentioned, involves this testing. And then the treatments involve what we call enteroimmunology or microbiome repair strategies. And there's a range of microbiome treatment strategies that are customized to each individual person. For example, some people have lots of food allergies. Their immune system turns on in response to different foods, makes a lot of histamine, and people develop symptoms from that. Some people have overgrowth of bad bacteria. Some people have overgrowth of yeast in their bowels. Some people have a pancreas that is a little bit weak. So it's a little hard to just automatically guess what is the specific microbiome problem in each person. But the stool testing helps us figure that out. And then based on that, we can create very customized, specialized testing for each person.
What happens if you don't take care of your microbiome?
Damage to the microbiome and inflammation from that is the major explanation for the illnesses that are currently in epidemic incidence.
How common are worst case scenarios?
Pretty common. For example, there is a large percentage, more than 70-80% of men over, say, 80 have malignant or cancer changes to the prostate. Breast cancer affects a great many people. There are illnesses that were never around before damage to the microbiome, like lymphoma, even prostate cancer. Esophageal cancer was relatively rare prior to damage to the microbiome, and also our obesity epidemic. And also being underweight. As we get older, some people are very underweight, and that puts their bones at risk, and frailty is a big problem. Why is one person in their, say, 70s struggling with the inability to gain weight, and some people are struggling with the inability to lose weight? Well, the differences between them are not so much genetic or hereditary. For the most part, they have to do with our microbiome. The microbiome bacteria control our decisions to eat. For example, you may know people who have sugar cravings or sweet cravings. Sometimes that is simply microorganisms that need to be fed. Everything we eat, everything we swallow, whether it is food, whether it's supplements, medications, get metabolized by gut bacteria. The foods that get into the human tissue in us have to be absorbed through the gastrointestinal tract into the bloodstream, and only then they get into the human tissue. So essentially, non-human cells see the food that we eat before our own tissues do. And it's interesting because when I started the Columbia Center, I was very dedicated to being of service to individual human beings. What I discovered was that understanding the microorganisms, the non-human cells within each of us, was essential to helping the human tissue. By optimizing the microorganisms in each microbiome, you can improve the immune system and you can stop the cycle of chronic inflammation for good. That will lower the risk for dementia, for cancers, for heart disease, can help us get out of the cycle of pain and suffering, fatigue.
What does it look like when you work with the patient over time at the end of the journey, when it's all said and done, regarding the microbiome? What does their life look like?
It's an amazing thing to see a human being enter wellness. They're empowered. I see a human being no longer anxious about what they're going to feel like tomorrow, anxious about what kind of food they have to eat. All of these things have been demystified. There is an increase in compassion in their hearts. There is a forgiveness of the past. The emotional healing is profound. I feel like so much, even emotional dysfunction in ourselves and our loved ones, have so much to do with chronic inflammation. And we know that even psychiatric issues like depression, anxiety, schizophrenia, autism, a lot of these neuropsychiatric conditions have to do with chronic inflammation that can be repaired. And I think that is a light at the end of the tunnel, and that makes me so hopeful and honored to participate in people's journey as they enter into wellness. It's not taking medications that people have to take all the time. It's being able to wake up after sleeping and do activities that you want to do. Play with your grandkids, go on bike rides, go hiking, just so many activities that we don't get to do when we're chronically sick. And that to me is a beautiful thing. It's revolutionary.